we all have been hearing a lot about this word called as black fungus. Okay, there's a lot of news hype around it. We see it every day on the news. We see it on social media. People are scared, So we thought if you could just enlighten us, what exactly is black fungus? How is it dangerous, or if it is dangerous or not dangerous? If you can give some more information on it to us.
Well, first it was the virus, now it is the fungus. Okay. So I think somewhere man became so greedy that we started thinking this earth is mine. It is ours, human beings. So slowly a small virus, which is a tiny organism, fungus possibly a slightly bigger organism than the virus, is trying to teach us that you are not the center of this circle. You are also one of the persons in the circle. So that is my basic understanding of it. The human need, human greed, not the need, human greed has brought us to this juncture. And then I think slowly every organism will tell and teach us where we are and where it should be. And I think that Vasudhaiva Kutumbakam, people say that Earth indeed is one family, means Earth doesn't mean only the human beings. Every plant, creature, virus, fungus. There are 5 kingdoms actually. If you go back to your biology, what is called as a protista, fungi, plantae, animalia, and monera. So one of the kingdoms, animal kingdoms, is fungi. So everyone knows about the white fungus. People will have sometimes scratchy feeling, itchy feeling, especially in the folds, especially in the summers when they sweat areas, especially common in diabetic patients and some people who sweat more. That is a white fungus. It is called as candida. Similarly, there is a black fungus also. Actual black fungus is called as rhizophus, which is seen on the bread. If you leave the bread on the kitchen for a long time, you see some black things forming on it. That is also a black fungus. If you look at this mucormycosis, actually it doesn't look black like the rhizophus, but what it does is it blocks the blood supply. That's why it's so dangerous to small tissues. That's why the tissue dies and the dead tissue is seen as black. So, like for example, gangrene, gangrene looks black. So, fungus causes micro blockage of circulation, kills that part of the structure of the skin, mucosa, we call it as the inner lining of the vital organs is called mucosa. You will be surprised that this mucormycosis spores, we call it as, like the hen and the egg, like that the spores of mucormycosis are all over the place. And sometimes it is also seen in the nose of normal people. You and I may normally harbor it. Generally, it doesn't cause any harm unless someone is immunocompromised. In the sense, someone's immunity is very low, like HIV patients, cancer patients, post-transplant patients. These are the only subset of people whom you used to see mucormycosis. Okay. So in short, it is a potentially lethal, means it can kill someone. Angio-invasive, means it invades the blood vessel. Angio means blood vessels. That's why angiogram we call it as. Angio-invasive fungal infection. So post-COVID, we started seeing some cases. I have not purposefully shared the slides because the pictures are really very scary and gory. So if someone has the heart, they can Google and see it, but I usually don't like to show them. It's really bad. It's usually, so we started wondering, why is it happening now? So as I explained, it is usually seen in severely immunocompromised people whose immunity is low because of HIV, cancer, or they have received a bone marrow or bone marrow or kidney transplant or liver transplant, and they are put on immunosuppressant. But now we are seeing because of COVID, so a lot of hypothesis starts coming in. Does COVID directly cause it? Is one of the things. Possibly yes, because it also COVID causes lymphopenia. Lymphopenia is one of the types of cells, white cells, which are defense cells for the body. Neutrophils, lymphocytes, what we call it as. Lymphocytes go down. When the lymphocytes go down, it's usually viral infection, sometimes in typhoid. And mucormycosis can thrive in that setup. Second reason is diabetes patients. Well, diabetes itself is a big risk factor for mucormycosis. COVID itself will increase the blood sugars so very much, especially many times non-diabetics are becoming diabetics. Diabetics who are under control are going totally out of control. So diabetes is another important risk factor. Besides that, steroid use. Steroids are good. Steroids are very bad. One of our professors used to tell, steroid is a drug which can make a dying person get up and walk all by himself to the cemetery. What it means is, if you don't use it properly under supervision, you may still cause more harm than good.
Okay.
Then lot of biological agents like antibodies which are using tocilizumab, bevacizumab, and so on and so forth have been used. That also causes immune suppression. Another interesting feature which people started wondering now, is it because of the oxygen use? There's a lot of controversy going on. Humidified oxygen versus dry oxygen.
Okay.
Or is it because of the load is so much in the hospitals that they are not having ample time to clean the tubing system? Third reason what people are giving it is whether sometimes we are using tap water. Instead of that, if you use sterile water, would it be better? Some also have put forward a theory of using sterile water or using methylene blue can reduce mucormycosis. But again, there is no definite data available so far. Some also say because of deficiency of oxygen, all of us are seeing a lot of industrial oxygen is diverted towards medical oxygen. So is that causing the problem? So lot of hearsay. Unfortunately, in this pandemic, we don't know much about COVID. Again, mucormycosis out of nowhere. It has come again as a big threat to us, and we are still struggling to find out.
Okay.
So if someone asks, so these are all the theories, Rahul. That's what the people tell, that these are all the factors. Is it just COVID itself? COVID causing reduced lymphocytes, diabetes, a new onset, or a diabetic patient who gets worse because of COVID situation, use of steroids, use of other agents like tocilizumab, bevacizumab, so on, and oxygen. Again, when I said oxygen, is it industrial oxygen versus medical oxygen, humidified oxygen versus dry oxygen? Is it the problem with the tubing, problem with the water, sterile water versus normal water, use of methylene blue? So these are all the things what are coming into our mind when we think of mucormycosis.
Okay.
So Rahul had also asked me to enumerate the symptoms of it. Again, please don't panic listening to symptoms, because many of the symptoms could be a normal symptoms like stuffiness in the nose, bleeding, some discharge in the nose, especially if it is becoming blackish. Sometimes it can happen in normal people or over the overnight and morning when it can have a black discharge, but not to worry, panic about it, but get it checked. Sometimes there is a redness in the nasal area. Sometimes eyelid can be involved. So it all spores enters through the nose passage. The nose, eyelid, ears, base of skull, the brain, the lower part of the brain rests on these structures. That's why it's a very, very technically difficult area and very, very vital area where it harbors the sinus, eyes, and also the brain. So symptoms could be related to the nose symptoms like nasal stuffiness, foul smell, bleeding, some discharge, especially if it is blackish, redness of the nasal eyes, sometimes eye-related symptoms like swelling of the eyelid, facial discoloration, pain around the orbit or in the face can be there. Sometimes if it is more, there can be proptosis. Sometimes the eyeball can come front. Sudden loss of vision can happen. Sometimes on the face, different sensation because it eats onto the nerves. Suddenly appearing that the eyelid has drooped down, restriction in the eye movement. And if it is still worse, it can cause facial paralysis. And it can cause, when it enters the brain, it can cause paralysis, body paralysis, and someone can throw a fit. So based on whether the nose, the eyes, the face, or the brain is involved, various sort of symptoms can happen, and sometimes it can cause death because of this various vital organ involvement. Remember, I told you all this happens because it invades the blood vessels, blocks the blood vessels, so blood supply doesn't happen, and that structure dies and it becomes black, giving it to the name called as black fungus. So how do we diagnose? I told you the symptoms, especially peri-COVID, post-COVID. You please suspect it if there are symptoms. Not hope not to see too many calls on just I'm having a headache or a nose block. Not the simple things. If it is persisting and progressing, then only we need to worry about it. But of course, we should be always careful about it. So there are imaging scan which we can do. People have learned about HRCT because of COVID. Now, one more scan people will learn because of mucormycosis. That will be specific scan is the gadolinium enhanced MRI. That's the most specific scan. Otherwise, if it is not available, a plain MRI with contrast or a CT scan also could throw some light. But the specific is a gadolinium enhanced MRI, as you suggested. Okay. Treatment, why are we so worried? Treatment is quite very tough. On the medications, what we use here are quite very toxic. We call them as amphotericin B. The plain amphotericin B has a heavy propensity to cause kidney damage. So that's why we worry. So now there are better formulation of liposomal amphotericin B, which is better, and some other drugs called posaconazole also could be used in this treatment. So again, it is teaching us so many things. So more importantly, what we should know is to know that this something of this entity is there. More importantly, how do I prevent it? So prevention of this mucormycosis, we actually call it as rhino-orbitocerebral mucormycosis. Rhino means nose, orbito means the eye, cerebral means the brain. So mucormycosis affect these three organs more commonly, especially in this situation. We call this as a rhino-orbitocerebral mucormycosis. So how do we prevent it? Be very careful. Firstly, try to follow the universal precaution and try not to get COVID as far as we can. As far as we are careful, it can still be prevented largely. Secondly, systemic steroids or steroids, what we tell it as, systemic means when we give it as tablet or injection, we should be very, very careful. Don't overdo the steroids. When they are told to stop it, stop it. Dose also, you leave it to the doctors, and please don't extend. I am still having cough, so I'll take another 5 days, 10 days. Please don't do that. Other drugs, as I said, tocilizumab and other monoclonal antibody drugs. Anyway, it is used by the medical practitioners. I don't think it is available. Tocilizumab, baricitinib, dabigatran, so many things come. Let the doctors decide, and we also need to be careful to not to use it overuse. Then we should time it accurately and also dose it accurately. Diabetes, most important. If someone is not having diabetes, COVID can give diabetes. Please check it once. If someone is having diabetes under good control, it can go still haywire. So please monitor that also. And when you are administering oxygen, humidifiers and other things, better to go for sterile water. And please daily change the sterilized humidifier and the tubes as far as you can. Sterilize them properly and then use it. Good hygiene to maintain. Again, goes back to the same commandments of masking, hand washing, possibly some amount of gargling would also help it. There is another drug called posaconazole. Please don't rush to buy it. Anyway, it is not easily available. Sometimes there are studies, and the European Association has recommended possibly using posaconazole may reduce the risk of getting mucormycosis. So that's about black fungus or mucormycosis. So all in all, it is not really black. And please follow the usual measures and it will be under control. If you have this unexplained headache, discharges, eye issues, please get back to us, but don't worry for every small thing what happens. Don't worry. Take care.